This is the model showing the internal structure of a blood vessel from internal to external. This is tunica intima, tunica media, and tunica externa or tunica adventitia. When we look into this is the lumen of the blood vessel, and this in green wire is the endothelial cell. This is the flattened squamous epithelium cell which lines the blood vessel, that is called endothelium, which is in the wavy pattern. In yellow color, these are the subendothelial connective tissue which contain fibrocyte in yellow color. This is in pink color is the smooth muscle. In black color, these are the macrophages which lies embedded within the loose areolar connective tissue, that is subendothelial connective tissue. This green color, this green color, this is the endothelium. When we look on the surface, this is polygonal, but we look inside around the lumen, these are the elongated structure. This has got many property that it controls the coagulation of the blood inside the blood vessel, that it inhibits the coagulation in normal cases, but in case of injury it promotes coagulation. Second one is it gives passage to the lymphocyte from the subendothelial connective tissue to enter in the lumen, mix with the blood in order to fight with the organism if it is present in the blood. Third is it senses oxygen tension in the blood as well as the blood flow and the blood pressure and act accordingly. Fourth is it maintains the tone of the blood vessel. And fifth is it is very much sensitive to histamine, that with the release of the histamine it becomes very permeable and allow the protein and blood to enter from lumen to the tissue and creates edema. So this is about this endothelial cell. And this smooth muscle which I have said of the tunica intima is given a special name, that is myointimal cell. This yellow wire, it is somewhat thicker and this is thin. In the tunica intima, longitudinally runs collagen fiber. What is the difference between collagen fiber, elastic fiber and the reticular? Collagen fiber is thick and unbranched, whereas the elastic fiber is thin and branched, and reticular fiber is thin and unbranched. So this is elastic fiber and this is collagen fiber which runs longitudinally in the tunica intima. And this flimsy structure, this is the fenestrated elastic fiber which is on the outer aspect of the tunica intima, in between the tunica intima and the tunica media. This is called the internal elastic lamina, and it is more prominent in case of muscular artery. This is mainly a elastic artery, or you can say the big artery like aorta, and the muscular artery is the distributing artery or a small artery. Okay, now come to the second layer, that is the tunica media, this one. It is very much thickened, very prominent in case of artery, but it is much thin layered in case of vein. what we see that as this is the model of the elastic artery, so there is this elastic lamina which arranged circularly, which I have shown on the exterior aspect. This circular, it lies all over in the circular fashion. Okay, so there is 50 to 70 layer of elastic lamina in case of elastic artery, and 50 to 70 smooth muscle layer in case of muscular artery. And it has got basophilic matrix which stains blue, and acidophilic is which stains red. So it has got basophilic matrix in which collagen fiber is embedded and smooth muscles are there. And this one, this is the chondroitin sulfate. Chondroitin sulfate is the proteoglycans. We all know that the connective tissue is made up of three things, that is the ground substance, cell and the fiber. And among the cells, there is glycosaminoglycans, proteoglycans and the glycoprotein. And one of the proteoglycans is chondroitin sulfate. Okay, and this white one, this is showing the gap in between the inner 2/3 of the tunica media and outer 1/3 of the tunica media. In case of patient of aortic dissection, the percent of aortic dissection which is more common in case of Marfan syndrome and the syphilitic aortitis, there is a gap, a tear in between the inner 2/3 and the outer 1/3 of the tunica media. This signifies that. Okay, and the most exterior is the much prominent elastic lamina which is called external elastic lamina, circularly arranged. And now this is the tunica adventitia. It is made up of fibroelastic connective tissue. There is fiber and the elastic lamina also. And what is this? This is the vasa vasorum. Each artery has got its own blood vessel to supply the oxygen and nutrients, and that is called vasa vasorum, which lies in the tunica externa and adventitia. And there is also this one. Here is the unmyelinated sympathetic nerve, lies in the tunica adventitia. This tunica adventitia is very much prominent in case of vein, whereas the tunica media is very much thin in case of vein, and tunica adventitia is thicker. So this is all about the tunica intima, media and the externa. And what is this? This is the elastic artery and this is the muscular artery. Elastic artery is the big artery in which the width of the wall is 1/10 of a lumen, 1/10 of the diameter of the lumen. Whereas the muscular artery, here the luminal diameter and the wall, its ratio is 1/4. That is the width is 1/4 of the luminal diameter. And in case of muscular artery, which I have said, is the internal elastic lamina is very much thick, and there is many muscles in the tunica media. There's 50 to 70 muscular layer and a few elastic lamina in the tunica adventitia, in the outermost. And this is the vein. The very significant feature is that it has got very less elastic fiber as well as the smooth muscle, which is not sufficient to maintain the luminal structure, the round luminal structure. That's why it is collapsible. So the lumen of the vein is collapsible due to less smooth muscle and the elastic fiber. Thank you.